Good afternoon, everyone. Sadly, in the last several weeks, two fathers of members of our cabinet have died. I want to take a moment today to honor and remember our members of the cabinet's beloved fathers. Mr. Walter Evans is the father of our Director of Recovery Ohio, Alicia Nelson. Mr. Evans died on February 12th. He was a gifted football coach in Akron for 25 years. He coached for multiple organizations such as the South Rangers, Buchtel Griffins, West Griffins, and the Akron Titans. Mr. Evans changed countless lives. He was known for his strong and competitive spirit, but also for his ability to help young people realize their full potential. I'm told he was the king of push-ups and could tell anyone to drop and do 20 at a moment's notice, including his 4 beloved daughters. If he really needed to motivate his players, he would have his young daughters come to the field and show the boys how his girls were stronger and could do more push-ups than they could. Mr. Evans touched the lives of anyone who crossed his path, especially his many brothers and his sisters and nieces and nephews and family members. We continue to keep his family, especially Mr. Evans' mother, Luella, his daughters, Alicia, Jasmine, Lexis, and Aaliyah, and his life partner, Tracy, in our prayers. Johnny McElroy, father of our Director of Aging, Ursel McElroy, died unexpectedly this past Saturday. Mr. McElroy, who grew up and lived in Youngstown, is a legend, both on and off the basketball court. He played for the Youngstown State Penguins from 1965 to 1969 and holds many school records, but there is one in particular that certainly stands out. In a game against Wayne State 52 years ago tomorrow, Mr. McElroy scored an astounding 72 points in a single game, setting the record books on fire. And this was long before three-point shots were allowed. It's also worth mentioning that during that historic game, he scored 11 more points by himself than the entire Wayne State team did. Mr. McElroy was inducted into the Youngstown State Athletic Hall of Fame in 1987, and his number 12 jersey is one of just 5 that the team has retired. Not only was he a phenomenal basketball player, he was a friend to all, a well-respected member of his community, a wonderful father, put his family first and the needs of others above his own. Fran and I extend our deepest condolences to Mr. McElroy's wife of over 50 years, his best friend, Delois, and also we extend our sympathy to Ursel, her 2 sisters, and their families. Recently, sadly, 2 of our family friends have also died, and I want to mention them. On February 12th, Larry Sherrod of Sabina, nearby Clinton County, died after a brief non-COVID illness. He is the father of our family doctor, Dr. Kevin Sherrod. You've seen Dr. Sherrod many times on our press conferences. He is certainly a wonderful physician, very good friend to our family. He's pictured here, Mr. Sherrod is, on the family farm with his great-granddaughter, Cordelia. Mr. Sherrod, Larry worked for many years at Delco as a millwright. He was also a gifted mechanic and a very hard-working farmer. He was a good and decent man. We continue to pray for his wife, Wanda, sons Kevin and Keith, daughter Kristen, and all of their families. Last week, Fran and I also lost our good friend, John Trimmer, Washington Courthouse. We've known John for many, many years. He spent his career working agriculture, real estate, farm management. We first got to know John when he was my father and mother's farm manager for the farms. He's continued to do that work after my parents died. John was a very kind and gracious and generous man. He loved the outdoors, loved his work in agriculture. He was active in his church, the Hedges Chapel Church of Christ and Christian Union, and we will always be grateful for his great friendship, his help with Father Tom Hagen of Hands Together and the school in Haiti. So Fran and I will miss John very, very much, and our hearts go out to his wonderful wife, Eva, his daughter, Rachel, son, Darcy, their families, as well as his stepchildren and their families as well. I want to offer my condolences to the family of Ohio Department of Natural Resource Officer Jason Lagore. He died in the line of duty this week. Jason Lagore was among those who responded to Rocky Fork Lake in Highland County Tuesday evening after two teenagers fell through the ice. A 13-year-old boy made out of the water, but while helping to search for a 16-year-old girl, Officer Lagore suffered a medical emergency and was later pronounced dead at a nearby hospital. Divers ultimately found the teenage girl, who sadly did not survive. This is a horrible, horrible tragedy, and our hearts go out to both families. Officer Lagore served 15 years with the Ohio Department of Natural Resources. He coordinated ODNR's first Canine Academy and was well respected across the state for his expertise with canines. He is survived by his wife, Michelle, two young sons, as well as his canine partner. I have ordered that flags be lowered to half-staff on all public buildings and grounds in Highland County, as well as the Ohio State House, the Vern Rife Center, and the Rhodes Office Tower in Columbus. I want to turn now to our schools. As we've spoken before, vaccinations have been available to all school personnel, public, private, parochial, every school in Ohio. And there's been certainly tremendous number of vaccinations that have taken place. This started in the first week of February. It will end this week. I think there may be one school that is extended out until next week for a couple of days for the site. But I want to thank the teachers, school personnel. I know they had to do some adjusting, and I want to thank our partners who are doing the vaccination because of the delay in regard to vaccines coming into the state of Ohio because of the storm. Some of these had to be rescheduled, and everyone was very, very flexible and got the job done. So by Sunday night, this 4-week vaccination will be done, I think, except with one school that will be finishing up in the next couple of days, the first couple of days in next week. So quite an accomplishment. Thanks everyone who was involved in this. Many of these teachers, school personnel have already received their second vaccination. Others will receive it in the next several weeks. By providing these vaccines to our teachers and to other school personnel, our goal, of course, as we've said, is to have all our students back in school in person by March 1. The chart that is up here shows the progress that has been made, and this is as of yesterday. As of yesterday, if we look at the numbers, the fully remote now are down to only 10 districts. That is 1.6% of all districts, and that is 6.8% of the total headcount of all students in the public schools. And as we said, many other private and parochial schools were vaccinated, but these numbers have to do with the public schools. So our goal of getting everybody back in March 1 is not going to be fully completed, but we've made a tremendous amount of progress. It's very important for these students to be back in school. I thank everyone who's been a part of this, and it's worked exceedingly well. We will continue to work with a handful of schools that will not be able to meet the March 1 deadline. We would encourage them to get the kids back in school just as quick as they can. I know some of them have made efforts to speed that up, and we certainly appreciate those efforts as well. But we're very happy that this is going to happen, and we're happy right now it's already happened for the great majority of our students in the state of Ohio. I want to talk now a little bit about nursing homes as well as hospitalization in general. We're pleased with the continuing decreasing trends we're seeing among COVID hospitalization in Ohio. Fewer and fewer Ohioans are in our hospitals because of COVID. Trend is particularly hopeful when we look at the numbers for those who are 80 and older. In December, those 80 and older made up more than 25% of our COVID hospitalizations. This month, that number has dropped to about 18% of our COVID hospitalizations. But even more important than that is that the total COVID hospitalizations have gone down. So not only are nursing homes a smaller percentage of the whole, but the whole is much, much, much smaller. So if we look at our data here, this is the number of Ohioans who are in our hospitals because of COVID. You'll see it continues to drop. And again, we felt that once we started vaccinating nursing homes, vaccinating those who are older, we would see a dramatic decrease in the number of people going into our hospitals, and that is what we have seen. So again, down to 1,262. That number continues, most days continues to drop, and we're very happy with that. We're also seeing a decline in COVID cases among nursing home residents. In mid-December, we had about 5,100 nursing home residents who had COVID in a given week. So that would be a snapshot for 1 week, about 5,100, 1 week in December. Last week, a snapshot, number of nursing home residents with COVID was down to about 1,000. Another way to look at this, we had in 1 week in December, we had 2,832 new cases in that week. Last week, we had 369 new cases. So we've gone from 2,832 to 369. And obviously, we're not satisfied yet. We want to continue to drive those numbers down. As of last week, we've given over almost 91,000 of our nursing home and assisted living residents the first shot, and 70,000 of those have already completed the vaccination process. They've gotten their second shot as well. Now, as part of our commitment to protecting those in our nursing homes, we also announced the COVID-19 vaccine maintenance program, basically to continue as people go in nursing homes, new residents come in, continuing to vaccinate them and make that vaccine available to nursing homes. Same thing would be true with a resident or a staff member who has changed their mind, who didn't want it before, now wants it. We want to be able to provide that to them, and we will provide that to them. We also have new hires, new people who have been hired or coming into nursing homes. We want to afford them that opportunity. So this program has now started, and some of the first vaccinations are occurring this week. So that program will ramp up, and we're happy that this is moving forward. I want to talk for a few minutes about spring events that are coming up. Last year, when COVID started spreading in Ohio, we issued guidance for these events to happen safely. Today, we're announcing the next steps to ease some of our public health measures while mitigating the spread of COVID. We know that the coming months will be critical, and we worry about the variant. That's the one kind of caveat to what I'm going to say. We don't know exactly what's going to happen with that, or what the effect is going to be, but we're optimistic. I'm very optimistic. We look about Ohio today, and as we see for a good part of Ohio, the snow is melting. We're finally seeing the ground. We have a lot of signs of spring out there, and we have a lot of things to be happy about as we move forward. Many people have asked, what about our prom? What about our graduation? What about the county fair? What about this parade? What about this festival? And so in the next week, we're going to try to give guidance in regard to those events. The guidance is based on what we know now, February 25th. And as the facts change, then we will adjust. We hope they go in the right direction. We're optimistic that they will, but we don't know that. And so we will continue to adjust. But the guidance that we're going to start with, we hope, as we move forward, we will be able to lessen up and expand. But the whole goal here will be for all of us to get back to where we want to be, get back to what our life was before the pandemic. There's a bridge to that life, and we have to take the bridge. And the bridge is really built on two things. One is vaccinations, and the other is to continue during this bridge to continue to wear masks. And there will be a point in the future, we have the herd immunity, where we will not have to wear the mask, and we'll be able to take the restrictions off. But we're now crossing this bridge, and I'm happy that we are here. 1.5 million Ohioans have already received their first shot, and many of them their second shot, and we're moving forward. So let me talk about that bridge for a moment before I start talking about some of the new ways to do things and how we're going to pull back our regulations. And I think people will be happy to hear about this. So let's talk first with vaccinations. Again, 1.5 million Ohioans have received their first vaccination. A number of those have received their second. We're moving forward. But we also know that there's been frustration from Ohioans. They've not been able to receive a shot, even if they are eligible. There's been a lot more demand than there has been supply. And I'm not telling you that that is ending, but what I am going to tell you is things are looking a lot better. So next week, we already know we will have 310,000 first shot doses in the state of Ohio. We've finished the vaccination of our school personnel, and we've also seen an increase in vaccine coming into Ohio from the federal government. So we'll be adding more sites, adding Myers, Walmart. Those are, you have to check. Not everyone will have it, but a number of the Myers, a number of the Walmart will have it. We're going to add a number of independent pharmacies. We know a number of you like to go to your independent pharmacy. That's how Fran and I grew up, and that's what we still do. We go to the Cedar Care Pharmacy, and when we were growing up, we went to Urbon Johnson Drugs in Yellow Springs. And so we understand about independent small pharmacies. And so the pharmacies that have signed up will be able to get that vaccine. We'll be getting that vaccine next week. We should also mention that Rite Aid continues to have the vaccinations, Kroger, CVS, Walgreens. We're also going to be able to send more vaccinations to the health departments and more vaccinations more doses to the hospitals. The news tomorrow and today and this weekend will also be about Johnson & Johnson. And we don't know when that green light goes on. We're assuming it's going to go on in the next few days, but we don't know that. But when that light goes on, we believe, based on what information we have from the federal government, that the first week, this would be an additional 90,000 doses. We are told by the federal government that the second and third week will be less. We don't know how much less. So this is going to be a ramp up very quickly and then down. But to make it very clear, the number I gave you before, the 310,000, did not include the Johnson & Johnson. So we're waiting. Can't announce those yet, can't allocate them yet, but we think and pray that they are coming. I want to look at the chart that we have. This is statewide vaccination chart, and if you can look on there. And this is something that I look at every day. And to me, it's aspirational and should be aspirational for all of us because we need to continue to get shots in arms. And as I said, we're going to have a significant number more shots this coming week. Doesn't mean there won't be people who still won't be able to get it, but I think obviously a lot more people are going to be able to get their shots. And then we have to continue to move forward on that. If you look at this chart of people 80 years of age and older, we are now over 60%. Of people 75 to 79, we are over 52% of that group. Those 70 to 74, we are at 40%. And those 65 to 69, we are at 26, almost 27%. So we need to see these numbers keep moving forward. I know some 60-year-olds and 50-year-olds have asked us, when are we going to see movement and when can we get it? We need to drive these numbers up that we have, the number of our people over 65. Again, 87% of all deaths have come from people over the age of 65. So we will continue to focus on that. And again, our pathway out of this, the bridge, two things: continue to wear a mask, and at the same time, it's going to be very important for us all to continue to get vaccinations. And I would say that if you have someone in your life or a neighbor who has had trouble navigating the internet or any reason, maybe can't get a ride, any reason can't get a shot, but they qualify, they're over 65, if you can help them do that, that would be a great thing. We spent some time this morning with some of the health departments talking about how we help, and we have ideas, and a lot of the local health departments, a lot of the local mayors are doing some great things. That work will continue as we try to reach those over the age of 65, particularly those who are having a difficulty either getting transportation or difficult time scheduling. So as we start back, I want to read a letter. I'm not going to read the whole letter, but this is just kind of illustrative of how we can get back and move forward. This is a letter I sent out a couple hours ago to minor league baseball teams in Ohio. But the reason I'm reading it is the basic principles apply. We can do this. We can be back and watch baseball this year. We can watch a lot of things. We can watch things that we want to do. We just have to, until we get this herd immunity, we need to continue. We'll have to continue to wear masks. We have to continue to be careful. And I start off, I said, here are some basic principles. And I think when people, ask what can we do, if they just remember these basic principles, I really, and these are not from me, these are from the medical professionals. But I'll just read them. Number one, the virus transmits best by airborne. 2, masks work. 3, distance matters. The further away you are from someone's face, the better off you are. Face to face, that's how it's transmitted. Time and close proximity to another does matter. The longer you're close to another person who you don't live with, the more dangerous is that encounter. 5, your bubble is smaller than you think. If someone does not live with you in the same home, they're not in your bubble, no matter who they are, no matter how close we are to them. Outdoors is better than indoors is number 6. 7, big indoor areas are better than small indoor areas. And 8, washing hands often and avoiding touching surfaces, both are very, very important. So kind of some basic principles as we move forward. Let me now talk some specifics. Get my notes here, excuse me. Sports and entertainment events will be able to reopen with a 25% maximum indoor capacity. and 30% maximum outdoor capacity, provided they follow established protocols. And again, this is a start. As I've expressed to the Reds and the Indians, some of the minor league baseball teams and others, look, we're going to start at this point. If the summer and the spring and summer go the way we think it's going to go, we're going to be able to expand these and move forward. Fundamental precautions must continue to be taken, include mandatory mask wearing for employees and customers, allowing a spectator pathway that allows for social distancing, and seating in groups, pods of no more than 6 people. And the goal is to have those 6 people who are in the same family. Each of these pods are separated from the other pods by the normal social distancing of at least 6 feet. General admission, lawns, standing room infields are allowed as long as masks are worn and 6 feet distancing can be marked and can in fact be maintained. All those seniors who are graduating this year, thinking about their prom, thinking about their graduations, those who are contemplating getting married, we know everyone is eager to make plans. And so again, this is the best we can tell you at this point. And maybe if you're getting married in July, things will be a lot better by then. We hope they will be. We think they will be. And this will be expanded. We hope it's been expanded several times by then. But this is where we are today. And this is what we can tell you today. Again, mask and social distancing are critical to being able to resume these activities. Unless you are actively eating, you'll need to keep a mask on at proms, banquet centers, wedding receptions. Each venue will follow safety guidelines. And we will be putting these out in the next several days, the specifics of this. But I just wanted to tell people this is coming. Proms, banquet centers, wedding receptions, changing the regulations in regard to them. Same way with fairs, festivals, and parades. You know, they're a little different. Particularly, you know, festivals can have a lot of people gathering very, very closely. We know that. So we're working with leaders from the fairs and from festivals, associations, talking to other leaders around the state, talking to members of the General Assembly to come out with the best and safest protocols for our fairs, our festivals, and parades. This is moving quickly, and we will have this guidance out shortly. Someone may ask about amusement parks. Amusement parks are operating under the same guidelines that they asked us to have last year. If they want to change those, they certainly can ask us about that, but we've not received anything from the amusement parks yet. We suspect they'll wait till we get a little closer to the summer. So that's moving forward. We'll have all the details when we put these orders out, but I just wanted to make sure everyone understood this is where we're heading. Lieutenant Governor, I've got a few more things, but if you want to make any kind of comments on that, and then I'll come back.
Yeah, thank you very much, Governor. I can tell you that you know, there's so many people who were waiting for this day. I know you've received the calls and the texts, and I have too, from people who were looking to plan for the future. And now I think it's reassuring to everybody that the planning can begin, that we can begin down that road back to normal. It's a slow road at this point in time because it's February the 25th. We don't know where things will be in April, but we know things will be. We know that there will things that can begin to be planned for and happen. And I know that talking to moms and dads about graduation and prom, that they are going to be excited to know that they have that future ahead of them. Those opportunities will be available, baseball games, weddings, things like that people want to know that they can plan for, and now they know they can. I think you made some really important points that I want to emphasize, that these events need to still happen safely. We're not there yet with the vaccine. And this is, this is an incentive for everybody to want to get the vaccine, because we watch these, when we see it, we see that when you get the vaccine, like we've seen in nursing homes and among our older population, that you see hospitalizations go down, you see cases go down. So as the vaccine becomes more and more available, we need people to take the vaccine so that we can continue to defeat the virus. And that makes the journey back to normal shorter when we can do that. So I really, I know that there are a lot of folks who've been looking forward to this day, to know that they can plan for that future. As we stand here on the 25th of February, this is the start, but it can get better as the circumstances on the ground get better, and we can move away from variances to just general guidance for everybody, so that we don't have to do all of these things on a case-by-case basis. That's the goal, is to set it so that people know the rules and they can plan. And just wanted to make those points, Governor, and I'll give it back to you. And then at the end, I do have some good things to share about some education and job training as well.
Good. Thank you, Lieutenant Governor. So, people will be able to plan for proms, they'll be able to plan for graduation. There's no reason these events cannot occur if we follow basic safety protocols. And we'll have the full details coming up in the next few days. But I wanted to tell people that same way, we can do fairs safely. So that's the good news. More good news. Our behavioral health hospital visitation. Beginning March 1, we will lift restrictions on visitors for our state's behavioral health hospitals. There'll be certain safety measures in place to protect patients and staff, such as a mask requirement, hand hygiene protocols, and time limits, but having in-person visitation will certainly play a role in well-being and recovery. This change is consistent with updates we are seeing across the state on visitation policies at our adult comprehensive care hospitals as administrators cease limitations on visits. And again, you're seeing a significant change in our hospitals. These were not our regulations, these are the hospitals, but they're making changes as well, and certainly allowing a lot more visitation. So if you've not checked lately, you got someone in the hospital, you can check with your local hospital. Veterans homes admissions. Last week I got a question about our veterans homes. We are opening up admission. These state-operated long-term care facilities stopped admitting new residents in March. That is ceasing. Now we're opening them up. As of today, admissions have officially resumed. As we speak, the Sandusky Veterans Home is welcoming a Korean War veteran who served in the Army. In the next few days, a Vietnam War veteran will be moving into our Georgetown home. Our Ohio Department of Veterans Services will continue working off its waiting list to admit more residents in the coming weeks and months. Resuming admissions at these homes is yet another example of Ohio's progression down the road towards recovery. More than 90% of veterans in these two homes accepted the vaccine, and they really set a great example. Our veterans did. And as right now, there are no positive cases at either location. As new residents are admitted, they'll be tested and then placed in a new admissions wing for 14 days before being transferred to the new living area with the rest of the veteran population. Today, I want to talk about our health equity page. Today at coronavirus.ohio.gov, we are launching a new section of the website highlighting our efforts to achieve equity in our pandemic response to ensure every Ohioan has access to the resources needed to protect against COVID-19. The webpage also provides resources that will allow communities, agencies, and organizations across the state to join in these efforts. A feature is a communications resource hub, where you will find various print, digital, audio, and video resources to help any Ohioan provide education about the vaccine to any number of different communities. Alongside general resources are materials created for specific groups, including minorities and Ohioans who speak English as a second language. Please take a look and help us reach all Ohioans with this essential information by sharing the materials you feel are most relevant in your community. We all have a part to play in making sure each and every one of us is able to move beyond this pandemic. And so making sure that every person who lives in Ohio has access to this vaccine is our goal. We've talked a lot about the importance of healthcare equity. As I said, minority and other at-risk populations are traditionally underserved, which is an issue my team is addressing, and I know local health departments are addressing and local communities are addressing. So they're working very hard on this. When it comes to vaccine distribution, all Ohioans must have access to the vaccine. All who live in Ohio must have access to the vaccine, no matter where they live, their income, anything else. That's why we're taking multiple steps to ensure there's equal access to vaccines and education about them. Among those efforts is our partnership with our federally qualified health centers in Ohio to make COVID-19 vaccines more easily accessible to underserved, at-risk, and minority populations. We're holding what we're calling pop-up vaccination clinics, just like we had pop-up testing sites. Now we have pop-up vaccination clinics. They're targeting these communities by the place that they're actually being located. Here is a video from one of our pop-up vaccination sites that was held in Cleveland last week. On Friday, February 19th, a clinic was held at Elizabeth Baptist Church. The clinic was hosted by Circle Health Services with help from the Ohio National Guard. Approximately 92% of vaccines, those individuals vaccinated in this clinic, that was administered to members of the African American community. And according to Circle Health, there were 2.5 times more African Americans vaccinated at this single event than all of their other vaccination clinics combined. Our team talked with a few of those in attendance who told us they were happy to roll up their sleeves. And so let's listen.
I'm excited to just get it out of the way and try to, even with the vaccine, I'm still going to mask. I'm still going to do the things that I know I'm supposed to do.
I just don't want to take a chance of going out without seeing my grandchildren graduate from high school. That's my main goal for doing it.
Come on, get the vaccine. It doesn't hurt. And hope that you're protecting yourself and all of your family members.
A clinic was also held last week at La Sagrada Family Church in Cleveland. The clinic was hosted by Neighborhood Family Practice and provided 200 first doses of the COVID-19 vaccine. 85% of those vaccinated identify as members of the Latino community. This local partnership with health providers and community organizations, these really are just vital in helping ensure equitable access to vaccines. There are several more pop-up vaccination clinics scheduled over the coming weeks, and we will continue to do these. We'll continue to work closely with providers so they can share information about these events directly with target populations. The pop-up clinics are open to Ohioans currently eligible to receive COVID-19 vaccines and typically require advance registration. This week, we held our first 2 virtual town halls for Ohioans where community leaders and medical experts could talk to citizens across the state and answer questions about COVID and answer questions specifically about vaccines. These town halls are open to everyone, but each one is focused on answering unique concerns of traditionally underserved groups. On Monday, we focused on addressing the unique concerns of African Americans who live in Ohio. Our panelists were joined by more than 13,000 people. It will be re-aired on the Ohio Channel this Saturday at 6 p.m. and again on Sunday, February 28th at 2 p.m. On Tuesday, we focused on Latinos and had nearly 14,500 viewers. This will re-air on the Ohio Channel on Saturday, February 27th at 7 p.m. and again on Sunday, February 28th at 3 p.m. We have 2 more coming up next week. On Monday, the town hall will address the unique concerns of Asian Americans and Pacific Islanders. And on Tuesday, the virtual event will focus on concerns shared by those who live in rural areas. These events start at 6:30 p.m. You can watch on the Department of Health's YouTube or Facebook pages. You can watch on the coronavirus. Also, you can watch on coronavirus.ohio.gov/townhall. Eric, let's quickly look at some slides. We'll see today's slides there. 2,400 new cases. Eric, let's take a look at the next one. Again, you'll see creeping up. We're getting more and more counties, a handful at this point, but more, who are under what the CDC calls a high incidence level. Eric, let's take a look at the next one. And these are our top ones. Our top one is now Morgan County and then Athens, and they're at about 3.5 times the high incidence level. Eric, let's go to the next one. And you'll see our slide alert map. For many weeks, our alert map has stayed the same. We got a little change. It's a change for the better. We have 4 counties moving to orange, which brings our total to 8 orange counties. So that's an improvement. This shows that the case rates for these counties are starting to drop, which is good. Let me now go to the Lieutenant Governor.
Thank you, Governor. It's great news about our K through 12 schools. 97.5% of them are already back with in-person education. We know that the commitment for all of them to be back who took the vaccine starts on Monday. And so it's great news on that trend. I also, though, as we're watching this happen, know that as I look at some of the statistics, we're seeing that the virus and the pandemic had an impact on higher education and the number of students who were earning industry credentials, earning college degrees. And we know that's been disruptive, and we know it's costly. I'm going to talk about a topic today that I often talk about, which is our Tech Cred program. And the reason I'm going to talk about it is because the staff tells me every time I do, we get an uptick in enrollment. So we need to talk about it then. We need to talk about what is available out there for people who are working, maybe people who lost a job due to the pandemic, or their job opportunities are limited because of their need to upskill and refresh their skills. We have, through the Tech Cred program, 1,000 pre-approved credentials. There's 1,000 different things that you can do. So look, when you have that many, there's something that has to be of interest to you and something that you have to have an aptitude for available in that list, because it's pretty expansive. Under the program, Tech Cred, you can get up to $2,000 for a industry recognized credential that we will pay for upon completion. The courtesy of the taxpayers of the state of Ohio, through 59 different higher education institutions. Many of them you can do online. We are seeing continued records every month. We'll have an announcement on this new one, but I already seen the preliminary data, and it's a new record for the number of people who've enrolled. So that's great. If you're interested in this, or if you have a son or daughter or a grandson or granddaughter who may be interested, go to techcred.ohio.gov to find out how you as an employer can upskill one of your existing employees. And I'm seeing this happening. In robotics, you have manufacturers upskilling people in robotics, both for programming and maintenance. In cybersecurity, hey, who doesn't need more cybersecurity talent today? If it's something that you're interested in, we've got cybersecurity degrees, certifications. We have green energy. We have construction technology. We have FAA certifications for drone pilots who do bridge inspections and land surveying and things like that. We even have a certification in a search engine optimization. What is that? Well, that helps you promote your product or your business online. These are all tech skills that you can earn through programs that we have at Tech Cred. You may already have a college degree, but you don't have one with the tech skills that you need to really make it in the workplace. This is available to you. You may be changing careers. You may be in hospitality and you don't have a job right now because, and you want to upskill. All of these things are available for you through Tech Cred and its sister program, IMAP, which is an individualized credential, okay, for anybody who wants to get one. And we'll pay up to $3,000 to help you get one of these short-term credentials. And understand, when we talk about these things, we're not talking about things that take you years to get. We're talking about things that can be done in days, weeks, or months. This is the time frame in which you can do this. And so if that sounds of interest to you, it's imap.development.ohio.gov. All of these resources are available. And if we're gonna have an inclusive recovery, if we're going to get businesses the talent they need, because literally right now we hear businesses say that they still can't find enough people in their areas because look, some businesses are booming, some businesses can't find enough talent. Let's help you get the skills that you need to go out and take advantage of what should promises to be a year of recovery, both from the pandemic and from our economic woes. And so please take advantage of these resources. It's a win-win for everybody. You get more skills, your earning power and job security improve, employers get somebody that's more talented that helps them compete against the rest of the world. So thanks, Governor.
We're ready for questions.
Governor, first question today is from Scott Hallis of the Xenia Daily Gazette.
Hey, Scott.
How are you?
I'm good, sir.
Good. Hopefully you and the First Lady did okay after getting your second vaccine dose.
Yeah, we did well. No problem. It was kind of like the first one for us, so it was good.
Good. So now that the vaccination of all the teachers throughout the state is pretty much complete, is there any thought to maybe starting a series of vaccinations for early childhood education teachers at this point, so we can get some more people who deal with kids on the road to being vaccinated?
Yeah, Scott, thanks for the question. We have looked at other groups, and we've not made a final decision on really where we're going in that area yet. But as I've indicated before, we know that the biggest indicator of vulnerability and possibility of death from having COVID is age. And we've carved a group out of, we think of roughly 200,000 people who have cystic fibrosis and who have other medical conditions. And we're working on getting them vaccinated, and we're working very, very hard on vaccinating people by age, because as we said, 87% of all deaths have come from people 65 years of age and older. If we go down to 50, you're dealing with about 97% of the deaths. So it is the best indicator. It will continue to drive what we do, but we may have some other variations on that. We'll stay focused on the age, but we may add a couple groups as well. But we're not ready to announce that yet. I wish we were, but we're really not. We've got a few more weeks, and I think I'm very happy with what we saw, what's coming. 300,000 this coming week is good. It's great news. And then we've got Johnson & Johnson coming on. So, that means we're going to move faster, and that's a good thing. But we've got to get the vaccination to those 65 years in age and older. We've got to get as many of them as want it vaccinated. And so my message for people who are frustrated, have not been able to get the vaccination, they're over the age of 65 or older, next week, give it another shot. And leading into next week, when people are starting to schedule, give it another shot, because 300 next week, and we may even have more if Johnson & Johnson comes on next week. So there's going to be more opportunity next week.
Next question is from Chelsea Sick at WKEF in Dayton.
Chelsea.
Hi there, Governor DeWine.
Chelsea.
So we just wanted to check back in about how vaccines are being allocated to counties, because we know our local county health departments are receiving more vaccines next week than they have since vaccinations began, which they're very excited about. But Clark County Combined Health District says it's receiving 3,500 first dose vaccines, while Montgomery County, which is much bigger, is receiving about 1,000 fewer doses. Miami County says it's only receiving 500. How are allocations being decided? And are there any updates about when the statewide vaccine appointment portal could launch? And what about the people who don't have internet?
Okay, you got three questions there. I'll try to get them. Look, people that don't have internet, we understand that's a problem. Had conversations with some health directors this morning, conversations on Monday, conversations with mayors a couple hours ago. So we're all dedicated to try to break through with that. And we hope to have some additional announcements, different things that we're going to do. But we know that at the local level, we've got health departments who are reaching out to people. So our goal is to have more places where people can actually call if they can't use the internet. We also you're going to see more health departments pick up the phone and call and ask people, do you want to come in? We're also seeing some other places do this. Now that we'll be able to go out to smaller pharmacies, frankly, I think many of these pharmacists, your neighborhood pharmacist will know, pick up the phone and say, hey, Charlie, you want to come in? I think that's going to happen. So next week is going to be better. People are going to have more of an opportunity to do that. Let me be clear again, though, about allocation. This is statistically done based upon the age, the number of people in your county over the age of 65 at this point. Now, when we go to 60, it'll be the number of people in your county over 60. And we are sending it out. Please keep in mind, we are sending this out to multiple locations. So when you look at your health department, that is only a small part of the story of what is occurring in your county. In almost every case, we have checked with health departments around the state. If they want more vaccine, they're getting more vaccine next week. So, but it's not just the health departments. They can only do so much. We have our federally qualified health clinics that are doing things. We have our hospitals that are doing things. We have our local pharmacies that are doing things. So we now have well over 700 locations, and with the additional ones that we've added, I don't have the exact number, but I'm sure we're well over 800 now. So more places to go, more vaccine, but the allocation in your county is based upon population. There is a 20% factor in there. It's 80% straight population. There's another factor in there based on poverty. And that is what the calculation is. We have a number. We allocate close to that number. It's rounded off probably, but every single week. So we're not shorting. I know some people in urban areas think it's all going to the rural areas, and rural people think it's all going to the urban areas. It's not. It's going out basically on a population formula.
Next question is from Molly Martinez at Spectrum News.
Hi, Governor. Good to see you.
Hey, Molly.
A few weeks ago, you made a plea for more scrupulous documentation when it came to race of those receiving the vaccine. Do you have specific numbers of how many more people of color have been vaccinated since you made it a priority for a more equitable rollout?
No, I'll see if I can get that. Those numbers look to me, just by eyeballing them, look like they were better. But I can't really give you that quantity, and we'll take a look at that and either report back at the end of this press conference or maybe on Tuesday. We'll look at those numbers and see if that percentage has gotten better. It seemed to me by looking at it that it was getting better, but we'll try to get you the real data, not just what I think. So.
Next question is from John London at WLWT in Cincinnati.
Hi, Governor.
Hey, John.
People down here in our portion of Ohio are being allowed to sign up through the Kroger website for vaccines at the mass vaccination site across the river in northern Kentucky. And many people have called us and emailed us saying when they show up for those vaccines, they're being turned away and told they shouldn't have been allowed to register out of state. Others have told us they signed up through Kroger and were successful in getting vaccinated in southeastern Indiana. I'm wondering what your take is on that, what advice you'd have to those registrants, and what it says, if anything, about the need for the now overdue state clearinghouse website.
Yeah, clearinghouse website is in fact coming, but let me just try to answer your question. John, we've not set any, and I'm not aware that Indiana or Kentucky has either. We have not told people that we will not vaccinate them from another state. We just haven't, we've not gotten into that. We just think that we're picking up probably some Indiana, Kentucky, and they're picking up some of our folks, and we've not done that. So that's not been our plan. What Kroger's policy is, I can't tell you that. I cannot speak to. But you mentioned Kroger, and I just want to mention something. Fran got on just to check Kroger and to see, and I think she told me she went on at our zip code, and there was no sites available. You know, there's no place to register today. There was no slots available. But then she just, for the fun of it, put in Columbus zip, and she went through. I think there were 6 or 7 places as of 10 o'clock this morning, at least, that had some slots open. So I would just, tell people continue to look for these slots. And again, my plea is if you've got a family member who needs transportation, or you've got a neighbor who needs transportation, or even if you've got someone who maybe he doesn't use the internet, if you can help them use the internet and get on. This is a time when we are all in this together. We need to help our neighbors, and I think what's going to help a lot next week is going to be a lot easier. There'll still be some frustration. I'm not saying everybody that wants the vaccine will get it next week, but what we're going to see next week is, at least 300,000 first shots next week. And again, we may see that push up to 400,000 by the end of the week. So there's opportunity out there, and we hope people will continue to help their neighbors and help people get vaccinated, because ultimately, the faster we get vaccinated, the quicker we get out of this. I talked earlier about there be a bridge, and the bridge is the mask and the vaccine, and we got to get to that next point in our lives. And the faster we can vaccinate, and the more people are willing to take the vaccine, the closer we're going to get to that. I'm not going to say what date, but at some point in the future, we're going to have more vaccine in here than we have people who want it. And then the goal is going to be getting people to understand that, hey, our future depends on more and more people getting the vaccine. We're not going to force anybody, but just through education and understanding, I think more and more people will want it. So thank you.
Next question is from Nathan Hart at WCPO in Cincinnati.
Hi, Governor. The percent of people 80 and over has been kind of hovering around 60% for a few weeks now. Is this mostly because of a supply issue, or is the state running out of 80 plus year olds that want to get the vaccine?
Well, that's the question I've asked a lot of people in the last several days. I watched that number, and I've observed the exact same thing you have. And that is, once it got up to about 58, it started creeping. And, it's made it over 60, but it's slow. So I've talked with health department directors, and I've talked with mayors, and I've talked with my team, what can we do about this? And we're all working on it. And, again, I would say for anybody, who's a provider, if you have a way, if you've got people on your waiting list, and, or if you're a physician, and you've got the vaccine, or if you're in a hospital, people who are 80 and above. We've asked all our hospitals, I'm asking them again, go back in your system, and everybody who's over 80, communicate with them and ask them to come in. Now, I know some people are watching this and 66 and say, well, why is he talking about 80-year-olds? Look, that's the highest rate of death. And we just need to get more of our fellow citizens who are over 80. The answer is, I don't know. I believe that we have not hit our ceiling. We need to get up into the 70s at least with 70-year-olds. That would be my goal. And I think we can do that. I think the other thing that's happened is, I think, and this is just a guess, but the guess is shared by some other people too, with the bad weather that we had, correctly, I suppose, some 80-year-olds are thinking, it's not really wise for me to go out in this ice and snow. And so, one of the other things that we're working with local health departments on is literally finding people who cannot leave their home, and then working to get that vaccine taken to them. The CDC has loosened the guidance, thank heavens, about transport. And so now it's easier for us to do that, but it is a work in progress. So thank you for asking that question, because it's the question that we've been really working on.
Next question is from Jackie Borchard at the Cincinnati Enquirer.
Jackie.
Hi, Governor. There's obviously a lot of excitement about the Johnson & Johnson vaccine. And looking ahead, will Ohioans have a choice in choosing either Johnson & Johnson or a Pfizer or Moderna vaccine? And does the state plan to target that single dose toward any specific population, given that it has shown maybe to be less effective for older Ohioans, for example?
Well, thank you. It's a very good question, and we're looking at that question, but we're really waiting for what's going to occur tomorrow. And anyone who wants to tune in can do that and watch as these experts talk to each other and try to analyze that. So we're waiting for guidance from them. But I wonder, Bruce, if you want to jump in here. I don't know if you're online or not. I haven't seen you up, but
I am, Governor.
You want that's a question you and I were talking about this morning, and I think it's Jackie's raised a very good question. You want to tell them what you know about that?
Certainly, thank you, Governor. Yeah, the early news, and that's what we have right now. We've got early news with preliminary review by the FDA. It is very good about Johnson & Johnson. We're likely to have a single dose vaccine that stores very nicely with regular refrigeration and a vaccine that has very little in the way of side effects. And importantly, it appears to be very effective. Now, it appears to be 100% effective for all age groups at preventing the endpoint that really matters, which is death and hospitalization. And what's really encouraging is that was true not just here in North America where they studied it, but this is the one vaccine that's been studied in South Africa and Brazil, where the more resistant strains are widely circulating, and that same strong outcome was observed there. Here in the U.S., it, for lesser degrees of illness, also looks to be very impactful, very effective. You're correct that in that early information, there was some question about its efficacy in people with multiple medical conditions over the age of 60 for that lesser degree of severity, the moderate to severe illness. But again, I want to emphasize, even in that early information, 100% effective for hospitalization and death. But as the governor noted, and I think this is a very important point, the advisory committee is reviewing the data themselves as we speak. They'll be meeting tomorrow, and we'll get much clearer and I think more detailed information about this vaccine and what it means for different age groups. So I would really encourage people to view any information that we have today as very preliminary, and let's wait and see what the ACIP over the weekend, and of course tomorrow, the advisory committee advising the FDA come forward with.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi, Andy.
Hi, Governor. I was wondering if you could talk a little more about the reopening of sports and entertainment venues, proms and graduations. Going forward with these new regulations, what do you expect the future of enforcing compliance will look like, especially with these school events like prom? I'm guessing, are you hoping to find a delicate balance so you're not cracking down on proms?
Well, what we have, first of all, we have seen schools, principals, teachers, students do a phenomenal job this year in class. When we started this, everyone said, well, kindergarten kids, they can't wear masks. And look, kids have done it. They've done it phenomenally well. This is not, maybe your dream of the prom, of people having masks on, but you can still have a prom. You can still have graduation. And I think we want to signal to people today, yeah, you can start planning. We can do this. because every day that goes on that we get more Ohioans vaccinated, things will continue to look better. The bridge is the mask and the vaccination. We got to keep that mask on until we get to the point where we've reached the herd immunity in the state, and we have crushed this. So I'm optimistic, and I fully believe that schools can put on these events, and they can put on these events safely by simply following the protocols, the basic protocols that we've put out. And they're based upon the principles that I read that was like when I started off my letter to the minor league baseball teams, just kind of basic principles. This is what we know. This is what works. This is what's more dangerous. We can do this. So optimistic as we move forward.
Next question is from Kevin Berry at WEWS in Cleveland.
Hey, Kevin.
Hi, Governor. The Cleveland School District announced today that it's going to push back its hybrid schedule. And because it's in a phased schedule, that means most of the students aren't going to be going back or have the chance to go back hybrid until the last week of March. So I guess kind of what's your reaction to that? And are there any steps that the state's going to take? Because I know you mentioned, potentially taking vaccine away, stuff like that in the past.
Well, we're not going to take vaccine away. We made a commitment to teachers, other school personnel, that we would give a second shot. And so we're going to give the second shot. We're not going to go back on our commitment. I'm disappointed. I'm disappointed by that. I'm not going to belabor the discussion. We've had this discussion several times before. But I will say this. I look at the cup or the glass is about 95% full. And we got about 95% of these kids back in school by March 1. We got some who are coming a week late, some are coming 2 weeks late, some maybe 3, but 95% full is pretty good. And we've come a long way from where we were in December when we had a large number of our kids, 41, 42%, I think, who were not in school at all. So I'm happy where we are. I wish it was 100%. It's not, but it's pretty darn good.
Next question is from Tom Bosco at WSYX in Columbus.
Hey, Tom. Tom must be having trouble getting through.
I'm there. I'm unmuted now.
Hey,
sorry.
there you go.
Forgot that part of it. You said a few minutes ago, my question's about sports and crowds as well. If the spring and summer go the way we think it's going to, we're going to be able to expand and move forward, is what you said a few minutes ago. What if things don't go that direction? Is there a possibility that gathering crowds like this could make cases go up? And do you have a threshold at which you might rescind these numbers of crowds, the 25% for indoors and 30% for outdoors?
Well, I think a lot of it's going to depend on how this variant really operates. Does it become the dominant strain in the latter part of March as we think it will? What does it do? And what does that additional fact that it spreads faster, what does that do? And we're going to watch it. And we're going to watch the early signs. The deaths are the last indicator, and the hospitalizations are a later indicator. But we measure other things. We measure hospital emergency room visits. We measure people going into their doctor with COVID symptoms. So these are all things that we are going to watch, and we're going to weigh everything. Every day that goes by, we get more people vaccinated. So that we think we're going to continue right down that path. And part of it's going to depend on how fast we get the vaccination. Part of it's going to depend on what this variant does. So there's a lot of factors in there. But if you're asking me the question, could we roll it back? Sure. I mean, no responsible person would say that we might not do that. We might, if that's where it is. I'm optimistic. I think we're moving in the right direction. We just have to be careful as we move forward. And we have to do it with good common sense, based on the science that we know. We can do the things, or at least most of the things that we want, but we got to do it carefully. but yeah, we're going to continue to monitor and continue to watch it, and we'll continue to put this data up, and everybody else in the state can watch it, and so we want to be very open with the information that we have.
Governor, can I just add one thing to that thought? Look, the one unknown that we have that can go against us is the variant of the virus that we don't know. But we got a lot more going for us in the sense that there's a big group of people who have a degree of natural immunity for already having had the virus. We have a growing number of people who have received the vaccine, which also is an impediment for the spread of the virus. And for everybody else, we have masks, and we know those work. We have the evidence that shows that you can be in places as long as you have a mask, and you're going to reduce the threat of the spread. So we have a lot more going for us now than we have going against us. And we just have to stay the course with these efforts, particularly on the masks and the vaccinations, to get us on that road back to normal.
Next question is from Jim Province of the Toledo Blade.
Jim.
Hi again, Governor. Early on, there was a lot of resistance to the vaccines among staff at nursing homes. Can you tell us what is happening now as the pharmacies make repeat visits and offer second and third chances? Are attitudes changing?
It went up a little bit in the second round, but not huge. I'll be able to answer that question more in a week or 10 days. We're literally just starting this new program, which is going to be the maintenance program in the nursing homes. And so we'll start getting a feel for how these nursing homes are doing. And I would just encourage, thank you for the question, because I would just encourage every nursing home in the state, every assisted living, to continue your education process, continue talking about vaccinations with your employees, as well as with your residents, particularly your new residents, because everyone's going to have that opportunity again, and on a continuing basis. We're sending out this vaccine basically through the normal chain of the drug company or the pharmacy company, that are supplying that nursing home. So this will be a steady flow of this coming into the nursing home. So we just would encourage the nursing homes to really work on the education side. And Jim, we should be able to tell you that in 7 to 10 days, kind of at least a snapshot of what we're seeing out there.
Next question is from Shane Stegmiller at Hannah News Service.
Good afternoon, Governor. I'd like to turn to the transportation budget. We're expecting a substitute bill on that in the House any moment now. Lawmakers seem to have kind of balked at the raising of the registration fees. Would you be okay if they remove that? They found some other funding mechanism for the patrol. And also, would you be okay if they took out like the distracted driving provisions?
Well, I received a call this morning indicating they were going to take out the distracted driving, but the speaker assured me that the legislature of the House would take that up. They would hold hearings. There were people who wanted to sponsor the bill. And so I'm disappointed because I know this saves lives, and I know every day we don't have it, we risk more people. And I know that as soon as we can get it in place, like most other states have, that we're going to start saving lives. And so to me, it's a matter of saving lives. I'm in a hurry about it, but I respect the legislative process. And the Speaker assured me there will be hearings. We will have the opportunity to make our case. I think when people hear the evidence that's overwhelming, that we can save a lot of lives in Ohio by the passage of this legislation, I'm confident that the legislature will pass it. As far as I didn't answer the other one. Look, we presented a bill that we think was obviously the right bill. Legislature, could work its will. Obviously, that happens in the House and the Senate. That's what the elected representatives are there for, and they can make their own judgments. But we have a very significant hole in the highway patrol funding, and the funding mechanism is not doing it. And so we have to continue to dip into the general fund to support the highway patrol. So, patrol is very essential, very important, been very important throughout. And they'll have to be supported.
Next question is from Adrienne Robbins at WCMH in Columbus.
Hi, Governor. Back to the sporting events and venues opening back up. Many have been critical over the state's contact tracing. Is that something that you're going to be looking at when deciding if we've gone too far or if we could allow more people at these things? And how much will you be relying on that contact tracing on if we are seeing spread from these events?
Well, contact tracing remains an essential part of public health. It's an essential part. It's been some form of it for hundreds of years. So it continues to be important. The volume of cases obviously impacts the local health department's ability to work on this. But this is something that we continue to look at, continue to monitor, and continue to work with our local health departments. We have people who we have employed to help local health departments, and they can continue, in the future if they need help. We're happy to give them the help that they need. Contact tracing is very important.
Next question is from Justin Dennis at MahoneyMatters.com.
Good afternoon, Governor. Good to see you.
Hey, Justin.
This is a question for both you and Dr. Vanderhoff. Earlier this month, vaccine eligibility opened up for people with severe congenital disorders, but readers have told us that those with other adult onset conditions that put them at high risk from COVID, such as type 2 diabetes, multiple sclerosis, or Parkinson's disease, feel overlooked. What's the latest on eligibility for those people, and what considerations have been made for the risks that they face?
Let me talk about it in general, and then I'll ask Dr. Vanderhoff to talk about it specifically. None of these decisions can be made in a vacuum, and they're all made based upon the fact that I can't change, and that is that the vaccine is scarce, and it's going to remain scarce for a while. And as long as it remains scarce, we're making decisions, we believe, based on the best science that we have, of how we save the most lives. It's not perfect, but that's our goal. So we set aside a group of age is the number one best predictor. We're working on age very, very hard. Second, we've got a group that we've set aside that you talked about 200,000 people, we think. And we're working hard to vaccinate them. There are other people out there that certainly have other good cases to make. We continue to look at that. But we try to go by the science. We do go by the science. We go by the best medical information we can. And the thing I would ask people to remember, when you make a case, say this group should be next, everybody's got a good case. Essential workers have a very, very good case. But we have to make that decision that when we put one person here, that is shoving somebody else back. And we're trying to do it in a way that protects the most people. So, Dr. Vanderhoff, you want to
certainly
give a more medical answer than that?
No, Governor, actually, you, as usual, answered it very, very well. The way I would summarize it is this. We're challenged to find the pathways that will allow us to do the most good for the most people with a very, very limited resource. And so as we look at these medical conditions, what we've done is focused on age, because age is the best predictor, as the governor has said. And then we've thought, well, where do we have circumstances where age does not better predict the risk of dying than does the medical condition? And there were a small number, the conditions that we brought forward previously. And as you think about them, they make a lot of sense. As we think about, for example, people with Down syndrome, many of those individuals are not blessed to make it to some of the advanced stages. People with cystic fibrosis, people with sickle cell disease. And so this is our best effort to help the most people, recognizing that age really is the best correlate for most of the medical conditions in terms of an individual's risk of dying.
Governor, next question is the last question for today, and it belongs to Alex Ebert of Bloomberg.
Good afternoon, Governor. Thanks for having us. This is a question for you and Dr. Vanderhoff. In the states of the North, also known as Michigan, they're having a raging debate about the use of the CDC's Social Vulnerability Index when distributing vaccines. We've got rural Republican senators in the state talking about how they want to end the use of that. And the state saying, no, we want to keep that because it helps prioritize vaccine distribution in areas of poverty and high minority population. How is Ohio using the CDC's index, and does it continue to do so to improve rates among the poor and minority populations?
Yeah, as I talked about a little bit earlier, 80% of the formula is pure population of whatever age group we're talking about. 20% has a factor in there with the things that you just talked about. And the reason that you do that, there's a couple reasons that we do that. We know, number one, that people who live in those areas generally die at an earlier age. They generally have a more, they're generally more unhealthy because they do not have the access to the medical care. That in turn makes them more vulnerable if in fact they do get COVID. So they also have a harder time accessing the medical system on a good day, let alone on a day when we have COVID and now a day when we have a scarce vaccine. So we think this formula is eminently fair. And it's a formula that, we have been using this formula throughout.
Governor, can I?
Yeah.
Well, Governor, can I add something to that? That in doing that, it's about making the vaccine convenient for people in those populations. It doesn't deny somebody who's outside of those populations from going to get the vaccine. It just creates a matter of convenience for people who have a harder time gaining access to the vaccine.
Dr. Vanderhoff?
Governor, I cannot add anything to what you and the Lieutenant Governor said. I think it was very well stated all around.
And that's our last question. We look forward to seeing everyone next Tuesday. Hope you all have a good weekend. Thank you.